I'd like to welcome everyone to the Monday, December 11th, 2023 Board of Health meeting. It is 6 p.m. We will roll call in. Stephanie Granger here. Michelle?
Here.
Megan?
Here.
Sue?
Here.
Joanne?
Here.
So we are all here. And with that, we will go ahead and move to our first agenda item, which is open forum.
I do not see anyone in question and answer or chat. Nope.
Okay.
No.
So we will quickly move on to the approval of the minutes. I did not see anything. Did anybody else find anything with the minutes?
I did not see anything.
I did.
You did?
Oh.
Okay. What did you find, Joanne?
I'm looking for my copy of minutes. I just was thinking that maybe we should have another look at on page 2 until help arrives and stop the bleed. I just maybe take another look at the recording, because it's not really to teach how to stop bleeding before help arrives. Like stop the bleed until help arrives at 2 different programs. So I think they just got kind of mushed. So if we could just take another look at that.
And maybe stop the bleed should be capitalized in the.
Right.
No.
So there
Because
was a stop the bleed training, and then there's a help until help arrives training, and they're usually done together. I'm assuming they were done together. You don't have to do them together because they're 2 different programs. A lot of times they run together. But one is literally talking about how to stop the bleed, how to put on a tourniquet, how to make a tourniquet kit, all of that kind of stuff. And then until help arrives talks about, calling 911 and how to assist in a situation and all of that. They go together, but they're 2 different things.
So the first sentence, then we should capitalize the stop the bleed in the is being held for stop.
Oh, yeah, that should be capitalized, but not to teach how to stop bleeding.
No,
Oh,
correct.
yeah. You're right. Yep.
And then,
Right.
and then there should just be a second sentence about until help arrives.
Yeah, so I think so. I think we just need to go back and listen to the recording to see exactly what Ray said. I think that just the sentences got pushed together.
I didn't actually know
It's
that.
a simple. I'm sorry. Yeah.
I actually didn't know that. So thank you. I didn't know it was 2 different programs.
They're 2 different, but they're always kind of run simultaneously because they go hand in hand, but
Yep.
they're 2 different things.
Does that mean then that we should put off approving the minutes then until, no, just with.
No, I think Ray can do that simply. Okay. The only other thing was, going forward, and again, we don't need to see these, but if we can put the time that the meeting is adjourned. That's
Absolutely.
all.
Yeah.
Other than that, it was really good. It was good.
All right. Is there a motion to accept the minutes then with that change?
I'll make the motion to accept the minutes with the edits.
Okay. Is there a second?
I'll second.
Michelle seconds. All in favor? Stephanie, aye. Michelle?
Aye.
Megan?
Aye.
Joanne?
Aye.
Sue?
Aye.
Sorry, I'm just going in the order you are.
Yeah.
We're moving around.
So motion passes unanimously. Yeah, Abby moved to the bottom. I don't know why. Okay. Great. The next agenda item is to appoint Amanda Welch, Dean of Students, Westford Academy, as a health agent for the sole purpose of issuing citations pertaining to the Westford Board of Health tobacco regulations. And this is just our regular, because she works at the academy and.
Yeah, so we reached out to both school resource officers just to make sure we have everyone. There's been some turnover, and Amanda's new to be appointed anyway.
Yeah, we we did it last month at the, November meeting, we also appointed the Neshoba Tech persons. They weren't here either.
Okay. I'll go ahead and make a motion to appoint Amanda Welch, Dean of Students, et cetera, as the
As a health agent.
health agent. Is there a second?
I'll second.
2 seconds. All in favor, Stephanie, I, Michelle,
Aye.
Megan,
Aye.
Joanne,
Aye.
Sue.
Aye.
Motion passes unanimously. Great. Okay, and then we have the request for the food services reduction to 150 for the Middlesex County 4-H Fairgrounds. This is something that comes up every year.
It is. So they did reach out to our office to ask for the reduction in fees again. I will say, I just want to let you know, I know our fees were just updated. We did reach out to Megan, and Abby has worked with Megan too to make sure we're covering our costs. I know it's still 150, but we did make sure that it includes inspections, in kind, and also administrative fees and hourly rates, travel, whatnot. So the 150 will cover it for everything out there. And, you know, they generally have lots of events out there, and for each event, they generally have to pull their own permit and pay a fee. So we're covered here.
How
Is this
much
for
would it,
next
how much
year?
would it typically cost?
So it typically the 150 will cover it. There's 5 outbuildings there, and Megan mentioned it takes anywhere between 2 and 3 hours. And so with her hourly rate, admin, whatnot, the 150 will definitely cover the cost.
No, but if we didn't reduce it, how much would it be?
I don't have that in front of me. Do you have that, Abby? What it would be for each building?
No, I can look it up though, real quick.
Michelle, well,
That's okay. I was just curious. Yeah. It's okay.
Is this for next year that we're talking about?
Yes, so this would be for calendar year 24.
Okay.
And this is something that you know, just for information, where Megan's new to the team, or the board. This is something that generally the board has approved in the past. Not to, you know, not to say they would continue.
I don't remember them coming this early though, because it's in August, but
Yeah.
I know we do it every year.
Yeah.
Yeah, they
just-
have a turnover of folks there on their board, and so they're trying to be proactive.
Well, I'd be happy to make a motion to reduce the food service fees for the Middlesex County 4-H Fairground to $150.
I'll second.
Motion made and seconded. All in favor, Stephanie, I, Michelle,
Aye.
Megan,
Aye.
Joanne,
Aye.
Sue.
Aye.
All right, so that motion again passes unanimously.
I'm just wondering whether we should put in what it is, though. You know, we talk about we're going to reduce it to 150, but we don't really.
From, you mean put in from what? it-
Yeah, from what
was?
it would be. I don't know. I think it's, you know, I have no problem with it, but it is funny that none of us seem to know how much it really would cost. Yeah, we do it every year, but
So next year, maybe we should have
Okay.
be able to show them what they would be paying and
Yeah.
and discuss that with
Yeah.
them.
Okay.
And you know, and for clarity too, it's for the 4-H fair. Because there's other things at the fairgrounds, right? So this is just for the
Oh,
fair.
so
correct?
maybe it
Do we
says
need to
request for,
amend that?
so
We may need
request,
to amend it.
yeah.
Yes, this would be for the 4-H fair, for their fairgrounds. And like I said, anyone that they have, for instance, an example, it's a puppy show there every year. Those folks pull their own permit with a fee. But this would be for a seasonal food permit, it's the 150.
And it's just for the 4-H fair though? Or is it for everything there?
So it would just be for the fair. It's for the fairgrounds, but the only thing they have out there is the fair, and then anything they rent out to, they have to pull their own temporary permit for it.
Okay. So should we clarify, reduce to 150 for the Middlesex County 4-H fair at the
Yeah.
fairgrounds?
Sure.
Yeah.
So do we need to make an amendment motion on that, or?
I'll make the amendment motion
Okay,
that instead of saying
amendment.
the way it is, that we'll just add, reduce it to 150 for the Middlesex County 4-H fair at the fairgrounds.
motion made to amend that. Is there a second?
Second to the motion, to the amendment.
All in favor, Stephanie, I, Michelle,
Aye.
Megan,
Aye.
Joanne.
Aye.
Sue.
Aye.
The amendment to that motion passes unanimously. All right, so our next item is the update on Health Department budget and the narrative and process.
Sure, so I wanted to make sure you're aware of the budget is going in front of the select board tomorrow night. Kristen, it's a 182-page budget narrative for all the departments, both every year. So I wanted to make sure you had that, what they're proposing for both an override and not with an override through town meeting, and how this will affect our budget. I know it's affecting everyone's budget. And so those items have been put in the packet, as well as the narrative that we gave this year to the town to put into their budget report. So once that goes in front of the select board, we'll wait to hear what kind of questions or who has been assigned from the finance committee and how we proceed.
It's very impressive, Ray and Abby, you know, all that you guys are doing. It really is.
So
Thank
we
you.
don't appear to be really impacted by the override.
No, I just want to point out a couple of things. It's about 4 items with the override, without the override and with the override. So you can see, for instance, the school dental program, if the override does not pass, that program has not been budgeted. So,
Ray, excuse me. I'm really sorry. I couldn't open it. Is there a way that you can share it, or
Sure.
is it easier just to talk about it? I don't know if I could open everything but that. I don't know why.
okay, let me bring it up here.
Is that all right with everybody?
Yeah.
Sorry.
Yeah.
Can you see that?
Yep.
Yeah, where is the school dental? Because I was just looking at it, but I don't.
Right. Right in the middle under laboratory
Cool.
services. Yeah.
Oh,
School
it's not a highlighted one. Okay.
And so we are proposing, as you're aware, for the public health nurse to use the clinical revolving fund moving forward to pay that position of full time. We're looking at a decrease by half for office supplies. Again, with meetings, conferences, and dues. So not too bad.
Some of that could get picked up by the PHE, couldn't it? So
Correct.
yeah, that way you're not really, you'll still be able to do stuff.
Correct. And
But
so
you
then
bring-
that.
You bring in so much money to the town through grants though. Like it's
Yeah,
really
we're not
impressive.
really worried. Yeah. So that, I just wanted to bring that to your attention, and if you had any questions, concerns, but certainly we'll keep you in the loop as the budget process moves forward.
You're doing a great job with that, Ray. Thank you.
So can I ask a question?
Yes, John.
So if the override doesn't pass, it would affect the dental program and then the gas and the mileage. And if it does pass, nothing changes?
So if the override, with no override, the dental program, school dental program only, not senior, consulting line item goes down by half, office supplies by half, meetings and conferences by half, and a couple other small things, dues and membership, office supplies.
Okay.
And I'll send that to you, Joanne, too, if you weren't able to open that. So in the
Okay.
narrative, we did add, our narrative is quite long, all the accomplishments, goals, and we did add the grants this year.
Good.
The
Good.
travel and the mileage-
Good.
Sorry.
It was
the travel-
17 pages. I decided not to print it out.
Yeah,
Is the travel mileage for if you're traveling somewhere, or is that just around town?
that's around town. So we do have 2 vehicles that we utilize. And so travel and mileage would be if someone goes to a conference or the vehicles are both occupied and someone needs to go somewhere or to an inspection.
Thank you.
Yep, sure.
Any other questions on the budget? Or comments? Thank you, Ray. Okay, so we are on to new business.
Community teamwork, support of resources for residents. So we did have a meeting with the town manager, the community wellness department, health department staff, some of the health department staff. We met with community teamwork, who provides quite a few resources here in Massachusetts. Things like SNAP, the WIC program, fuel assistance, to see what some of the resources are that they offer for homelessness and whatnot. So we have put that out through our social media pages, and we're working more with them on offering programs here for residents. So I just wanted to bring that to your attention. For instance, social media we put out today about fuel assistance, and actually the eligibility requirements are higher than I anticipated, so that's good news for residents here that might be having a hard time at the holiday. So we just wanted to make sure you're aware of that.
It's great.
The next item is the holiday resources regarding food safety support, help, and assistance. So that was also in your packet. And so Brittany Nash, our regional community health worker, has put together quite a bit of information and classes for the holidays, especially where there's a hard time with alcoholism, AA meetings, resources for our youth and kids. And so she put out quite a bit of information on holiday resources, so folks should find those resources if needed.
And what was the part at the top about the NHANES?
NHANES is the examination survey letter.
Oh, you've got down below. Okay.
Yep, so that's below. Yep, on old business. But yeah, so I just wanted to bring that to your attention. There was also a flyer in your packet about volunteers needed. The Greater Lowell Health Alliance is putting together a 24-hour Zoom space for folks that might be lonely or just need some assistance or someone to talk to. And so they've had great success with this Zoom webinar program. This is their third year. And so they're looking for volunteers to sign up for whether it's a half an hour on Christmas Eve.
Can you remind me who Carrie Dentremont is? I know I recognize the name.
So she is the executive director for the Greater Lowell Health Alliance. Okay. And I know Brittany and Nicole have both signed up for this here in Westford to assist folks. And
so how does it work? You can, like, you sign, so you go and you sign up for a period of time?
Yep, like, you can sign up for a period of time that's open. They generally have 2 people on. Okay. And it could be something like you're showing them how to bake cookies, or you're just there to, provide some friendship and guidance if needed, whatnot.
Oh, okay.
Just for folks that are lonely and could use a little.
That's cool.
Little support. So
that's awesome. That's really awesome.
So that the Healthy Westford Committee and community partnership meetings, I just wanted to give you an update. Healthy Westford Committee, I did meet with Kristen last and the members of this committee. The chair has stepped down. And so after a long discussion, we decided to put these committee meetings on pause until we receive the results from our community needs assessment. Who
was the chair?
It was William Harmon, Bill Harmon. And he's on the Trails Committee, and I believe the Pedestrian Safety Committee, but don't hold me to that. And so he decided, I've been on for a long time and I'd like to step down. So I just wanted to let you know that we've decided to put that on pause for a little bit until we receive our community health assessment results. And we did just have our 3rd partnership meeting with all of our stakeholders. So that's going really well. We have 1 more meeting left, and then hopefully the community needs assessment will come together. So yeah, and that slideshow, there was quite a bit of data on Westford, everything from mental health, substance abuse, environmental health, So I just wanted to give you a snapshot of some of the data that our consultants have put together.
Is that BME, Ray?
Yes. Yeah, they did a great job with pulling all kinds of existing data, US Census data. If you get a chance to just flip through that PowerPoint presentation, there's quite a bit, you know, how far it is to a park here in Westford from any resident, you know, things, really great information that can help recreation department, the pedestrian safety with sidewalks. So I have passed that on to folks that we think might find that information relevant.
Brittany and Nicole have been a welcome addition to the health department. Yeah, they're doing a great job.
Yeah, they do a wonderful job. So, yeah, absolutely. So that's new business.
Old business.
Again, so the National Health and Nutrition Examination Survey letters in your packet. I just want to make sure you saw that. They were really grateful for the participation of the Health Department, Board of Health, and the Westford residents here. I wanted to also let you know that the schedule of fees is updated and ready to go for January 1st. Abby's been working really hard with our IT department to make sure all of our applications are up to date, as well as we're ready to roll out for January 1st to the public. So she helped me update our fee schedule as well as Mandy, our admin. So I'm grateful for their assistance on that. So ready to go.
Thanks, Abby, and welcome back. It's good to have you.
Okay, so update a special registry of Westford residents. We have an intern who's just about to finish up. She's been amazing, Siobhan. She is a community health student at UMass, and so she's just about to finish up. She's done some great projects that we'll be sharing with you with the next month or so. But one of them I just wanted to bring to your attention. We have our special registry for folks that might find themselves with either an ambulatory issue, mobility, or disabled in some way. So we keep that list current here in Westford in case there's any kind of shelter that needs to be opened, or is there some kind of emergency, say due to a storm. So that has been a very popular program with residents here, and generally we have an intern update that list, call each one, make sure it's up to date.
How do you find the people for that?
So we have an application that we put out through the senior center and we put out through social media, and anyone that has, whether it's a child or an elderly family member can sign up and just fill out the application, and we add them to the registry. So, you know, God forbid we have some kind of event, we can work with our first responder partners to make sure that we address any needs such as events or that kind of thing, electrical needs.
That's great.
So she's done a great job with that, and she's also finishing up on a flyer on mental health resources for teens and youth. It's also for parents. So, you know, parents generally don't know where to go. First step, very overwhelming. So her and Brittany have been working on that flyer. So we'll bring that to you in January.
Will that be posted to the website then, or?
It will. Yep. Yep. We'll bring it to you first so you can see it. And, you know, I've already seen several drafts, so they've been working on that. Next is the opioid overdose rescue kit. So I did put that in your packet. Brittany did a great job of putting the guide together. We're actually working on a letter for businesses here, besides the one that's already in your packet. Because what happens is the box goes up and then no one knows where it is or that it's even existing. So we want to put together a blast draft for business owners to send out to their staff.
This is incredible.
I'm
Really?
really excited. It's part of the Sandbox initiative through MHOA. And we ordered 26 boxes. Those already went out, posted in all the school buildings, town buildings. We ordered 20 more for businesses, and we already have 12 assigned.
Wow.
Businesses
Wow.
that have reached out since last week. So Brittany's going to be busy with Narcan training and taking pictures of making sure the boxes go up and whatnot. So I'm really excited about that. And let's see, mental health resources for teens, we talked about that. She wanted me to mention, Brittany, that we were just at the 6th annual Merrimack Valley Substance Abuse Disorder Summit. And so they did talk about the Restorative Care Project Center that's going to go in Middlesex. And so that is a statewide initiative to put this center in Massachusetts to offer services for folks before, unfortunately, it's an alternative to jail or to offset the hospital emergency rooms with mental health. So those are some exciting things that are happening here in the state. Just checking my notes 1 minute. And
Where is that gonna be, Ray?
they won't disclose the location yet. They're very close, but they won't disclose where it's gonna go.
You mean
we're waiting.
ever? Or
No,
they
they
just haven't
will.
picked it yet?
No, they will event, they'll build it. But no, they haven't said if it's gonna be in Worcester County. That was a question that was asked. And so it's quite a big facility. So we're waiting to see where that ends up.
Is there a projected, so I didn't realize it was something that's being built.
It
So
needs to be built. Yep. So we do have quite a few politicians here in the community, Middlesex Sheriff, a bunch of folks who sit on behavioral mental health services programs in Massachusetts. And it's part of the Massachusetts Behavioral and Mental Health Committee. All the folks that sit on in the Restorative Center is one of the projects that's come out of that committee. So that's exciting to see. And January 3rd to Brittany and Nicole will be teaching mental first aid, to our Westford Police Department. So our hope is to bring more of them on board with that certification. So I know mental health is, a part of our goals here for the department and certainly very important. And so we just want to make sure you're aware of these initiatives.
great, thank you.
Mhm.
Is there anything else? Does anybody have any questions or?
Last thing I just wanted to mention, it wasn't on the agenda, it just came in late Friday, was we just received our second portion of our PHE services grant, which totals $581,487. So that's to hire a licensed social worker here for the community, as well as regionally throughout our 4 communities, and also for a regional inspector. So that grant contract will go in front of the select board tomorrow. I think I'm on at 9 o'clock. So I just wanted to make sure you're aware of that.
And so this regional inspector will be doing what?
So it's a little different for each community. So that grant covers Acton, Westford, Dracut, and Lowell. Some will be utilizing for housing, hoarding, tobacco. For Westford at this time, initial reaction is to use this position for helping with evening and weekend events. It gets a little tricky with union positions, as you can imagine. And so we did have to get permission to make sure that whoever we bring in, we had to get permission from the union. So we'll leave it there.
Okay.
But we're excited about the licensed social worker position. And our hope is to reach out to more with the schools. We've been talking with the schools what they need for additional services for elementary. They seem to have the high schools are covered.
Can I just say one thing? So, I teach nursing students on their psychiatric rotation, and we had done something recently about stigma. And I just wanted to share with you, have you guys ever heard of Kevin Hines? He's a motivational speaker, and he survived jumping off the Golden Gate Bridge. And he's pretty amazing. But one of the things he says, which I think is just really thought-provoking, suicide, mental illness, and addiction are the only diseases that we blame the person for perpetually. And so I am thrilled that as a department, you guys are doing a lot of work with mental illness and with addiction, because these people need help, and there should be no shame. There should be no stigma. So I have to tell you, I've been on the board for years and years, and I am so thrilled with all that you're doing now to address this and support people in our community. So thank you so very much.
Thank you, Sue.
Absolutely.
And Ray and Abby.
Yeah, and we'll certainly pass that on to Nicole and Brittany. It's a team effort, as you all already know.
Yeah, and I know that, I mean, it has been an issue for the town, you know, a priority, and it's great to see progress being made.
So I
It's
think
good to
that's it for
see
me.
It's good to see the PHE money, being used well.
Mhm.
They've been throwing money at us and with conditions and all this other stuff, and it's sometimes hard to use, but you've done a great job navigating that.
What does the E stand for? I know public health, E.
Excellent. The Public Health Excellence Shared
Excellence.
Services Grant.
Okay.
Is kind of what it is. We just
Thank you.
put it down to PHE. So my question was for this, these new hires, is this with the additional funds that came through the PHE? That they said you could hire more than before?
Yeah, so it
Good,
does, as you
good.
know, pays for Brittany and our consultants. This will pay for training for all of our staff if they want to be credentialed more than they are. It will certainly pay for these two positions and everything that comes with the job, whether it's mileage, equipment, phones.
Mm.
And it also will pay for brand new inspectional software for all 4 communities.
And does that help us, Ray, also in the whole, oh, I'm blanking. The certification, the public health.
Oh, the blueprint?
The blueprint and accreditation. Yep.
Accreditation, that's the word.
It does. And the town, it's important that you know that the admin fee for this grant is 87,000 back to the town.
Should come back to the health department.
No
We're working
kidding.
on it.
Yeah.
For a little, yes.
All of it.
Good job,
That's
Ray.
great.
For working so hard on this and
Yeah.
doing such a good
Impressive.
job.
Impressive.
No, thank you so much. And I think that's it for us. Unless you have anything, Abby, I'm sorry.
No, I'll make a motion to adjourn.
Well, we can see if Abby, do you have anything to add, Abby?
No, I'm all set.
Excellent. Okay. So Sue, you were what?
I make a motion to adjourn at
Excellent.
6:32.
Okay.
Second.
And seconded. All in favor. Stephanie, I. Michelle,
Aye.
Megan,
Aye.
Joanne,
Aye.
and Sue.
Aye.
Thank you all. And
You made it by 3 minutes.
We did. Amazing.
What is meeting ever?
Well, have a good holiday. And
Happy
Hanukkah.
holidays.
Yep.
Thank you so much.
Bye, everybody.
You too.
Bye, guys.